Hello, everybody. Again, this is monetizing innovation. And one of the things with this episode, we're really excited to have a special guest with us. But just a basic introduction here. Innovation isn't just about the big idea on the whiteboard or the strategy deck in the boardroom. It's about the messy challenges, the tough calls, the missed signals, and the leaders who choose to push forward anyway. And today's guest is absolutely no different. A wonderful gentleman by the name of, Ross Youngs, and he is the founder and CEO of Biosortia Incorporated. He's been a trailblazer for over 35 years and has experience inventing technologies across industries, holding more than 75 patents worldwide. Through Biosortia, Ross is pioneering industrial scale microbiome mining to unearth novel natural compounds that could power breakthroughs in biotechnology, medicine, agricultural, and beyond. Tune in and learn more about his visions to the environmental science and impact of science and entrepreneurship in a platform that taps nature's hidden chemistry for real world impact. Thank you so much, Ross, for your time today. Uh, one of the things I think it's definitely worth jumping right in with your background and experience, as well as looking at all the work that you've done and the different experience. What are some of the things that you're doing, especially with your company and the microbiome mining at industrial scale? What are some of the breakthroughs that you've come through?
Terrific. John, it's a pleasure to be here today, and thank you for the opportunity to give a little insight in what we've done in innovation it's really over 40 years at this point. It's kind of wild. But when you talk about microbiome mining, there's some things people have to understand because a lot of people don't know what a microbiome is other than they've heard that they can take probiotics, prebiotics, and they need to keep their gut healthy. Let's put it this way. Microbes and microbiomes have been on this planet for 4 billion years. And with that, they terraformed what was a hostile methane environment of Earth into this rich, luxurious, oxygen filled planet that really has allowed life to expand. And through those 4 billion years, microbes and microbiomes dominated the planet. We think today that, insects, animals, fish, plants dominate this planet. No, not really. It's the microbes still. Other than woody biomass, they actually outweigh all other biomass combined. And just in the human, we have 30 trillion human cells, but we have 40 trillion microbes, not counting the viruses, which would be most likely, and they're called viruses and phages, most likely 400 million. So we're dominated by our microbial environment. And we've all heard 23andMe, 23,000 genes. Our microbiome has more than 25 million genes, making up the majority of signaling chemistry that occurs inside of a human. That's hard to believe, but science knows such a small percentage of that, way less than 1% of what's going on. So when you talk about microbiomes and you talk about innovation, the lack of knowledge in that space is key and critical. But what we do know is important as well. And I'll give you one simple fact. Microbes have put directly, indirectly, or inspirationally more than half the drugs on the shelf. And that's with human access to those small molecules of microbes being less than 1%. So less than 1% access to microbes put more than half the drugs on the shelf. It's phenomenal where we could go with greater knowledge.
And from your background, I would assume that that's just the tip of the iceberg, right? Especially as you look at really the sensitive biologics that are being used by pharma and now the tailored healthcare. I assume that a lot of that's built off this biome knowledge.
Well, you would think it would be. And what we're lacking is we're lacking knowledge to really build on. With that, when you talk about innovation, exploring that space of what we're missing and what we have, that's led to three theorems and three theorems about how to dramatically improve the productivity of drug discovery. In fact, our early estimates say that we would reduce the cost per approved drug by more than $1 billion by implementing these three theorems and balancing out portfolios, drug discovery portfolios, so they can take advantage of what nature can teach us.
Yeah, that's absolutely phenomenal. Do you see that, especially with some of the work that you're doing and the innovation in this space, the direct parallels how AI can also assist in that discovery?
Well, I love the advancements of AIs. They have allowed us to use that as a tool.
Mhm,
What we've got to understand about AI is a great leveler.
mhm,
It's not a great advantage maker. Where your advantage can come from is the data and the training sets. And that's what's key and important. And to give you an example, Biosortia with its innovation, when we look at what humanity has collected as knowledge on microbes and their small molecules, their drug like molecules, we know that's only about 36,500 molecules. Now, remember, out of that 36,500 molecules came half the drugs on the shelf. In one execution of Biosortia's core technology, we discovered another 73,000 novel small molecules and another 41,000 training sets. So the data expansion Biosource is experiencing, along with AI's capability, is allowing us to do predictive de-risking of molecules in the drug discovery pipeline. So typically, the typical synthetic approach takes 40 programs starting, 40 programs going through preclinical. Some of those will fall out, make it to IND, make it to phase one, phase two, phase three, and then finally to a drug. But it takes 40 of those programs to start to get to one drug. Right now, we're seeing by focusing on the drug like molecules of microbes, that being 4 programs to get to one approved drug. That's a phenomenal cost reduction, that $1 billion I talked about earlier.
yeah.
We envision with improvements in data, improvements in understanding, that going to 2 programs at the earliest stage starting, and one of those actually making it to a drug. That'll be a phenomenal opportunity to reduce, for the first time, the cost of getting drugs into the market. And we'd like to say it all is about what you start with. If you start with great material that could be a drug, your probability goes up dramatically.
I mean, it's just amazing putting it in the perspective of the numbers that you just shared, right? We're talking several orders of magnitude reduction that, like you said, quickly reduce the drug cost and everything else associated with it.
Yeah, absolutely. And I'm sure terms like I'm going to use right now have been used over and over and over again. But history shows we had this golden age of pharmaceutical in the 50s and 60s when we cultured microbes, could get at their molecules and find drug like molecules that worked in a human. A lot of antibiotics, a lot of cancer cures, other things really came from microbes. But that was just touching the surface. What we're seeing is you go deep into that microbial matter, you can find molecules that were not expected to be found. So our depth is to such an extent. So when you talk about orders of magnitude, I like to point out that a typical drug discovery program might start with a 100 milliliter sample. That's a 3 ounces of material, a little less. The reality of it is our program starts with 200 million times that. You're talking 9 orders of magnitude as a starting point, meaning molecules can't hide from us. And what we've seen in our initial execution of this technology that really it's all come together in the last few months. But the execution of this technology has allowed us to find a weight loss opportunity that instead of it being a GLP-1 that hits that hard to create weight loss, it hits it a little softer, but it coordinates other targets that are meaningful around weight loss, more in the way a natural molecule would have. And with this, what we're seeing is a potential oral molecule that hits multiple targets. It's called polypharmacology and would do so with potentially less side effects and be more gentler on the system and create weight loss for those that are potentially super obese and those that may want to lose 20 pounds before a wedding. Now, all of this is what's called in silico. It's all computationally derived. And the next step is to get it into a wet lab where you can test the screening and the binding, and you can actually test it in animal models. But what we believe is with more and more knowledge from nature, we're going to find opportunities to de risk and prioritize molecules at the earliest stage with the highest probability of acceptability.
That is just truly exciting and revolutionary when you think about the whole current process today. I don't know that many folks fully realize, right, the potential that you just laid out there when it takes that many shots in the beginning, right, to get to phase one all the way through phase three. I think it's like on the order of only it's like less than 7%, right, of all compounds that actually clear.
Yeah, it actually is, and it depends how you count the start. So what we're counting is at a de-risk lead molecule. So you've already got a molecule you think could get there. And that right there is meant that a lot of work has gone into that molecule to be able to claim it's a lead and to have 40 programs that need to start to get to one at that point. We'd like to convert that to 2 programs to get to 1. Obviously, it'd be great if you could start 1 program and get there, but 2 is such a amazing, let's say, stretch goal that we're pretty happy with that. And if we're successful, we believe that pulling out nature's prior molecules, using synthetic capabilities to improve those molecules, but use the nature as the starting point, that we will create a platinum age of pharma, which means we're going to start to attack diseases and treating of diseases or curing of diseases on a scale over the next 20 years that'll be phenomenal.
Absolutely. I can completely see your vision as well because what you're talking about is truly game changing. And I like your example too with the GLP type drugs. One of the biggest problems too in drug delivery today, right, is compliance, especially if you're doing injections, things like that. Being able to go to an oral form and designing it from the onset with the work that, like you said, you're already starting from a base of knowledge. That's truly revolutionary.
Yeah, absolutely. And when you can make it simple for the patient and you can make it so that it doesn't create issues with the patient, you've really solved the majority of the problem. A lot of people don't realize this, but TB is still up there as far as the number of deaths from tuberculosis every year. Now, why is that? Because we've got medicines that solve it. It is compliance, especially in Africa, where a patient gets to a clinic, starts taking the drugs, feels better, leaves, never comes back. So when you hear finish your antibiotics. There's truth to finish your antibiotics.
Absolutely. No, that is completely true. Yeah, so with this journey that you've been on and the work that's gone into the various discoveries and patents that you've created, what have been some of the biggest challenges that you've faced, especially in this space?
Well, I think when you do something different in life sciences, it's unlike many other fields. So I got advice from a couple people 15 years ago. Do not even attempt this. Now, I believe in the end, the tenacity, the determination will be, I am so glad I did. But I understand that they had a better recognition of how biased, how entrenched, and how tough the life science community is. They talk about rigor, they talk about scientific peer review. It's basically nearly impossible to break it and fix it fast. To use the Elon Musk method of how rocket engines were improved is a great innovation example. I mean, I love that. And there's some good stories on YouTube that you can go and you can say, well, what really changed with the rocket engine? And it is a pure simplification to the extreme that I love. And I think that in life sciences, we can go back throughout history and you can go back to Galileo, basically presenting to the scientific minds and the governing minds of the time that, hey, the earth isn't the center of the universe and neither is the sun. And, back then it was not received very well. It was jail, no, that's not true. And then in the 90s, the Pope actually said Galileo was right. We shouldn't have done that to him. So, I mean, that's a few hundred years of whether it was actually corrected at that point. I don't think Galileo got the end result in any way. And I like looking at every major innovation. And this is hard to believe. Every major innovation that occurred in life science occurred from the edges or outside of life science. It didn't occur with the general thought, whether it was genomics, whether it was antibiotics. Antibiotics took 40 years almost to get into practice. And then it started saving lives immediately. When you look at the mRNA approach to vaccines, they were ridiculed by the science community for a decade. So it's not easy to come into science and actually have a change or even receive investments. Investments occur with shiny objects from storied personalities that have a history of making, let's say, acceptable advances within the biased community. So you see people getting funded hundreds of millions of dollars because they're doing essentially Me Too with a twist.
No, I definitely agree with that perspective. I think you also have the built-in bias, right, of the system and the sense of the nice thing is you have the peer reviewed, which I think that is very constructive. But you also, to your point, it's a bit like breaking into jail, right? You're trying to help influence, a different perspective and a different thought process. What are some of those challenges when you think about like the funding and trying to be able to look at some of those areas? Like, what is the bright shiny object that you think has really been standing out for the work in this space?
Well, in this space, it's what's called, according to the three theorems that we've put forth, and we've got that paper being reviewed right now for potential publishing. But the first theorem is basically about finite, and it really resolves around AI, and it revolves around being able to use training sets or prior knowledge in order to do predictability. Well, one of the problems is you have this finite training set which is natural molecules, to which we understand very little of, but we understand some. Then you have the infinite, which is the synthetic biology, synthetic chemistry, the exploration into what is natural like, but not natural. That infinite data set is also balanced by possibilities. In the case of small molecule, drug like molecules, you could have nearly an infinite number. There's numbers basically saying between 1 times 10 to the 60th power to 1 times 10 to the 30th power to essentially infinite. And that's just drug like molecules. So basically, if you play in that infinite space and only focus on the infinite space and you train on the infinite space, you're actually getting further away from what's real because of dilution. You have got so much going on in that space, it becomes harder to do prediction. Now, that synthetic infinite space is where science has been playing for decades. So our expansion of data sets has gone exponential. There are trillions of potential molecules they've found. But here's the interesting thing, the possibilities versus what they've found. So you take the percentage of what they've found to the possibilities, even using synthetic data, and you're talking about point zero followed by another 100 zeros, 1%. So they can explore this synthetic space, this dilution of space for virtually forever. And they will get further away from the truth of understanding what works in biology. Over on the other side, the finite, which is the molecules that work in biology, that's actually a small data set, but we know so little about it. So the third theorem is hybrid. You can take the tools, the technologies of the synthetic world and apply them to the training sets of the natural priors and come up with investing in natural priors as you invest in synthetic, and you actually get a better result. These three theorems are mathematical, and they are proven based on the math and based on the understanding that occurs there. And they're testable. So to me, understanding that and understanding how to deploy that in the pharma world is one of the most important things. Now, the nice thing is Biosortia understands it completely. So we've got a huge advantage right now because we're also creating the natural prior data sets.
No, and that I by the way, that's one of the clearest explanations too that I think I've heard on, the complexity, right, that you're dealing with. So I really appreciate that because I think for the layman, right, it really is complicated. And like you said, that dilution factor, it's real, right? That can really dilute the chance to find that true solution or true cure.
Absolutely. And to put it into an analogy that may make sense to everyone that just said, huh, what did he just say? Let's think about sounds and how sounds are languages. Well, there is an infinite number of sounds. And if we just created sounds randomly and tried to train off random sounds, maybe we collected sounds from birds and insects and said, we're going to have the human language English, and we're going to have Chinese, and we're going to have all the different languages. The reality of it is you can't just make this stuff up. You have got to have prior training and rules in order to understand. And a hybridization of using the tools to synthesize is fine because what we're doing today is we're using those tools to synthesize English in a way because of the rules. The same thing is true with drug discovery.
No, absolutely, and I think that's a great analogy. It definitely speaks to the complexity, right, of what's possible. So when you look at especially the work, and I love what you said a few minutes ago, especially in the sense of you know the rule set that you guys have been working on and developing, and that you know you didn't expect necessarily to step into this journey 10 to 15 years ago into this particular space. What were some of the things that gave you the early encouragement, and then what were some of the tough spots that you had to work through once you kind of hit the first couple walls?
Yeah, the basic alignment is always around better, faster, cheaper, differentiated. And I think if you look at innovation in general, if it doesn't hit one of those, what does it hit?
Exactly.
So we think those are basically the four rules. And if you can get better and cheaper, if you can get better, cheaper, and faster, all of a sudden you're starting to prioritize your own potential for innovation. So when we look at tough things, one of the toughest things was getting microbes out of a very dilute solution or from a solution created. So microbes, when we look at, let's say you look at a lake and it looks green. Well, that's the photosynthetic producing microbes that are in the water. There's a community around them of bacteria, fungus, actinomycetes, viruses, phages. It's a community of microorganisms. They're small and they vary. Anybody that has ever filtered lake water in a chemistry lab where you have a vacuum filter and a zero point zero 0.02 micron filter, you pour a little bit of that lake water in there and it blinds the filter immediately. You've got a situation where it creates a cake, and that cake, because of the pressure, blocks water, which is 1/33,000th the size of a microbe, from getting past them. It's a plug, and it happens immediately. And the more you wait on those microbes to get the water out, the more they're changing. So you've got this dynamic of microbes can change their metabolic pathways in less than 15 minutes, and no filtration capability in the world can process them effectively. There's your challenge. Now you've got to innovate around that. And that's what we did. And that's what we got funding from ARPA, DARPA, US Air Force, NIH, Los Alamos National Lab, State of Ohio, support from universities, and then our own funding support to solve that problem so that we could go out there and start to understand what these microbes in this very complex environment. Now, all of a sudden, you've got 1,000 species and all their molecules and all their DNA. Now you've got to be able to handle that. So that was another hurdle. So the hurdles in this are actually immense because the first challenge is how in the world do you remove water away from a microbe at negative pressure with a filtration device? So it was a little bit like the challenges that, quite frankly, going into space provide.
No, I totally agree with you. I actually did a lot of work with PTFE over the years and expanded PTFE. So I definitely relate to the challenges that you're talking about because you can blind that filtration capacity so quickly. Yeah.
Yeah. Yeah, in absolutely seconds. It's amazing when you put that pressure and you're pulling through a filter and all those various sizes of microbes in such an incredible density of trillions just blind the filter.
Absolutely. Yeah. And then like you said, that second wall, I think both of those are such significant challenges of themselves. And it goes to show, one, you just the technical tenacity, right, to be able to
Yeah.
solve these complex problems, which you and the team have done. Did that also some of that technical success? Is that what you feel was also the trigger that then started getting some of that support and funding and recognition to take it to that next level?
Well, we're still working on the funding, believe it or not. So
Uh,
the core technology to do what you needed to do to get the microbes completely solved. The core technology for deconvoluting them to get to the molecules and the data completely solved. The next thing we needed to do was scale. For 7 years, I was looking for scaling funding so we could do it chemically, so that we could do it in a factory environment. We're still going to do that at some point because that accelerates our knowledge gain, but we never found it. But the fact that we did do it at subscale proved that we could obtain the data. Obtaining the actual molecules is our ultimate goal, but obtaining the data on the molecules has been a shift with AI and our training sets behind it that is accelerating our discovery anyway. So it's all of a sudden we had two paths. So for years, we knew we had the direct physical chemical pathway, and that we were still pursuing, and we will be doing that at some point. But now we have the AI data set advantage that is giving us depth of knowledge and understanding that's incomprehensible at this point. It's an advancement that's going to accelerate dramatically.
no, absolutely, and I love that example too of just how you walk through that because I think so many folks, right? AI is in the news everywhere, and I think almost to the point where as a layman, some folks don't even understand the true power of AI, right? But here's an example where no, AI is such a powerful tool when utilized, right? With training it against the right data set, building that data set. And so building that initial core technology to get to that information, right, is just game changing.
And I think what was so surprising about the weight loss molecule we found is this is a structure that shouldn't have been able to be predicted, but it was because our training data was so good. It predicted a structure that's synthetically amenable or addressable of a small molecule. And what's so amazing to me is we were able to use AI to even try to understand where and how this came from. And the story goes like this. About 1.5 billion years ago, this molecule was competing for space. This microbe that makes the molecule was competing. So instead of killing its opponent with an antibiotic or a toxin, it basically convinced them they didn't need to consume resources. So it was starving them. Ultimately, that metabolic pathway got involved in higher organisms and how it would work in a human today if we were, let's say, normal. Between antibiotics and diets of today, we're not at all normal. In a normal habitat, it would have protected its habitat by saying to its host, quit eating. You've got enough food here. If it would have inundated its habitat, it would have advantaged its competitors. So it was in a fine tuned balance. And I would say, if you think about how you feel after the best meal of your life, that is likely, and I say this knowing I've got no evidence, but it's possibly the reality of a molecule being released by a microbe in your own gut system that says you're full, you're satiated, you don't need to eat anymore. I'm hitting your targets where you want to eat. And guess what? You're happy. And if you eat any more, you might get sick. That is exactly what it looks like this molecule does. And I'll give you one other example. One of the targets it hits is the same target nicotine hits. And you look at people that smoke, they quit smoking, they gain weight. They start smoking again, they lose weight. One of those targets is within the target hitting, which tells me This is a complex system, and there was a molecule designed by nature to hit those. What we've also found is when you analyze that molecule, and it had 9 motifs to its structure, you could get it to work with just 4, and you could tune it with the other ones. And looking at how it computationally targets these different targets, it's just exciting to see that a structure like that was from nature that we can now use to the advantage potentially as a drug. And obviously, it's day 0 on that, meaning all of that computational power suggests that now you've got to get it into the real wet labs, real animal models, and advance it through all the studies. And currently, a lot of those fail. We're predicting it has a higher probability than traditional because it came from nature.
Absolutely. No, and I think that's the, and you alluded to it at the very beginning when we started the discussion. I think the work that goes into that front end, right, of even identifying the right molecules that can target, right, the right response. This is just a prime example of cutting that 40,000 number that you talked about down to a much smaller number before you even start into the FDA pipeline.
Right. Yeah, and that's our whole goal. And here's one of the things that's been hard for science. I'm not the PhD scientific researcher that has my peers to worry about. I am the guy who can go, I've got a vision. I see what it takes to get to that vision. So innovation itself sometimes needs a massive driver, somebody that will kickstart the innovation itself. Elon Musk is a great example of that over there in rocketry. I would actually say survival off this planet is going to depend upon microbiome and microbe fingerprinting. So I would actually say there's a connection to microbes because they're so key and critical to our life here on Earth. To think that they won't be is kind of avoiding the reality. Now, what we do know is all of the microbiomes and the microbes on Earth that make it to space, it gets a little sideways pretty quick. So we're going to have to understand what we're uncovering to have the vision of how sustainable colony off of Earth.
I love that connection that you made too, because it's so absolutely true, right? I mean, even they've with the plant studies they've taken to the International Space Station has even shown, right, that things that maybe they can get them to grow for sure, but it doesn't grow the same way as on Earth, right? And the biome's different, the biosphere is different.
And the microbiome is different. And every organism on Earth has a microbiome.
Absolutely. No, I love that connection because I think it's so true, and that is gonna be one of the really great leaps, right, as we try to look at colonization and things like that off world.
Yeah,
I
absolutely going to be critical because if you take a sample, if you take a chemical sample of almost anything these days, what you get is what you know. You see the peaks of what you know. All that noise, all that dark matter of biology, that unknown stuff, that needs to be known.
absolutely. No, that I yeah, I can think about just, one of the typical graphs, right, that show the peaks of the elements and things like that, and like you said, there's it's the interstices of between all those that is the critical information, as we move forward.
Well, we're going to learn it's way more critical as we move forward in humanity than we believe it is necessarily today.
Yeah, no, I think that's a very true statement.
Kind of like junk DNA didn't turn out to be junk. Why would it be? Nature is efficient. Of course, everyone that ever studied evolution knew it wasn't junk.
I love it. That's great. We know we have covered so many topics, and one of the things that you've touched on a little bit, but it'd be really interesting to get your perspective too, is the lessons in building these deep tech companies like yourself. You've already touched a little bit about the long timelines, the risk. What advice would you give to others that are trying to also venture out in this space to help with the building of this knowledge and trying to get to a viable commercial business?
I would say that leadership, um, your own personal drive, your own motivation is paramount. You can't create a team of equally motivated individuals. You can create a motivated team,
Right.
and it usually takes resources and it takes vision, but there's going to be that differentiation in motivation. And if you, as the driver, are not driving, it's going to be difficult to sustain it. And if you think those surrounding you will be part of the key motivation, it will for a while, but wait till it isn't going right. Everything must depend upon leadership. There is without a doubt in human societies the dynamic of organization of people, group dynamics. And that group dynamics almost always takes a leader to make something happen. And I think that that's one of the reasons when you look at capitalism itself, there is the freedom for that leader to take that risk and move forward. And um, a lot of people don't have that sustainability. I like to tell when I was talking to graduate level business students, entrepreneurial groups, that if you're an entrepreneur, you probably are going to hit that wall 7 times and you have got to climb over it each and every time. And maybe once you'll have somebody there to give you a boost, maybe twice, maybe you'll have a team to help you get past that wall. Maybe your family and friends can chip in. The reality of it is, you have got to keep pushing if you're truly going to be that small percentage of survivors and succeeding at a business.
Uh, I think that is such valuable advice to folks because that is so true, right? Innovation's far from neat and clean. It's very messy, very challenging, and it takes that perseverance, right, to continue to. And the team is critical, but you also have to, like you said, have that inspiration and vision to continue to push forward.
Yeah, and I think they proved it recently with the Tesla shareholder vote. That was getting behind a leader and saying, "You know what? If you can do this, we're all gonna win." Sure. You know,
Exactly.
I loved that because there is some truth that without him, it would be hard. And I think that there's examples of that. You look at Steve Jobs leaving Apple the first time. Steve Jobs learned a lot before he got back to Apple. And those were probably very important lessons, but he did ultimately get back to Apple and take it to where its destiny was going to take it.
No, I think that those are two great examples, right? And I think it goes to show the importance of the power of small teams, but the power of small teams really need to have that successful leader, that visionary leader that can lead, lead through the I would say through the darkness, right? Because you hit those dark patches and you gotta continue to keep on pushing.
Yeah, no doubt about it.
I have to admit, Ross, this has been an absolutely wonderful discussion. I'm really excited to share this with our audience and definitely look forward to continuing our dialogue. I think we're definitely such an incredible intersection, and the work that you and your company are doing is just so exciting. And I really appreciate you taking the time to share some of these challenges. I have a kind of a long record in innovation as well and learning some of the similar lessons. And so if there's anybody that you come across that you think could benefit from some additional help and support, I'm a big believer too that while we have to have that strong leader, like you mentioned, sometimes it does take a community to help folks be able to continue to stay the course and drive that. So I toss that out there. I'm happy to help any folks that you may know that need some additional assistance And definitely, I'm a big fan of promoting our innovation network because it's a challenging environment, but it's also so exciting about the possibilities of where we're at and the work that you're leading.
No, I think that's great, and I hope some of your listeners hear that and think that connecting is the right thing to do because it is. I'm a firm believer in teams, and I'm a firm believer in multidisciplinary teams. I think that that's one of the challenges in life sciences because you can have a very smart person in a position in a lab and everything's centered around them. And why in the world could a mechanical engineer help him understand something in the life science world that he's the expert on? And the reality of it is that cross functionality is even critical in a space like that, whether it's egos or whether it's the belief that they can't be helpful. That's the worst thing for innovation.
Ah, that is well said. I completely agree with you, and the power of those cross-functional of relationships and cross-discipline relationships, it's amazing how much can be applied, right? Once you learn a fundamental principle in one field, how it can be applied to others, and it takes some of that willingness and openness to discuss, right? And I think that's powerful.
It is, and you've gotta look at problems from the different angles, and it may be that that expert who's at the top gets frustrated at explaining it to a mechanical engineer or an electrical engineer who has nothing to how in the world can you know anything about what I know? They may actually spark in just the communication onto something that is brilliant. So people who ignore that opportunity to team, ignore the opportunity to progress.
Absolutely. That to me, I think, is a fundamental philosophy that I think a lot of the great innovators have, right? Is they are always that student of the business. And by that I mean they want to learn, right, as much as they can from anybody and everything. And I think that's very critical.
I know we're getting close to that time, but in one of the companies I ran, we were looking to solve a problem. We started two internal teams that were blinded from each other, and then we paid a consulting group to start solving this problem as well. So we had three different attacking of this. And then we reviewed, we whacked the outside team first, then we whacked our internal team and combined resources. And then we met in the basement of my chief engineer's house on a weekend with four whiteboards and basically redrew the entire approach in about an 8-hour session on a weekend. And then that turned into a new multi-million dollar business for a small company in fairly short order. And we ultimately got the technology inside of key companies that have that historical, not invented here type of barrier. So we actually put this equipment inside of those kind of companies because it was such a brilliant execution of a technology.
I love that story. That's another great example, right, of that cross-discipline team, and especially when you can share that knowledge because both teams learn knowledge that was different, right, from the other, and then by being able to combine and really understand, you're able to map out, an entirely new path, which it is the power of that collaboration.
Yeah. It was one of the biggest winners for my other organization.
Oh, that's fantastic. Ross, I can't thank you enough. This has been such a phenomenal discussion. I really look forward to continuing the dialogue with you here as well, and I would love to have you back on again to share the continued work. This is just so exciting, and I think this really does have the potential to really change the way we look at medicine and so many other things. Right? I think it's fantastic.
I appreciate that. I know I'm a firm believer that it's going to have a massive impact. And I can tell you right now, people have been down the road of doing the same thing and running into the same walls for so long. I understand why I've got 99 out of 100 doubters. I get it. I got to admit, I figured myself fairly well versed on technology. And when I heard Elon Musk was going to land the booster, I'm going, wow, that's tough. And he's proved it wasn't tough. I love that. I love that.
I'm right there with you too, right? Because the first time we heard that, it's like and much less on a barge at
Yeah,
sea.
you're taking the fuel up. You're already fighting gravity. Now you're going to add more fuel. It's like, wow.
And that's like one of those times where it's like, it's beautiful. I love to be proved wrong. It's wonderful.
I was definitely a skeptic, but then I didn't dig into it either.
Yeah, exactly. No, and thank goodness we have some of these innovators that we do today, and it's really, I think, brought us into, like you said, a new age of science, which is so incredible.
Absolutely.
Well, thank you, Ross. I will look forward to definitely continuing the dialogue and hopefully our viewers. And we'll make sure to put your links, both your LinkedIn and your website in, so that if folks have follow up questions, we can do that. And again, thank you for your time. I look forward to the continued success of your company and learning more.
Well, fantastic. I appreciate that. And your listeners should be able to find on our site that reversing rooms law, which is purposely backwards Moore's law. And rooms law basically says we keep spending more money in pharma and getting less results. And that's doubling the cost every 9 years for the same output. So
Yeah.
that's what we're trying to reverse.
No, I love that, and that's such an incredible vision, and I'm so excited about the potential.
Thank you.
Thank you.